Solomon.
Solomon.
Thank you very much, Mr. Acting Deputy Speaker. Last month I held a mental health roundtable to hear directly from stakeholders about some of the issues and concerns that they had in their sector and how they relate to the Territory. So I'd like to place on record my thanks and gratitude to Steve Valanis, who is the coordinator from Casey House, which is a youth refuge in my electorate. Lorraine Davies from the Mental Health Illness Fellowship, Chris Frank from Banyan House, which is a residential therapeutic community in my electorate, Emma Reid from Top End Health Services, Mark Smiley from the Salvation Army, who operate the Sunrise Centre. I'd also like to place on record my thanks to Richard Campion from the Top End Health Services, Wendy Archin, who's the Executive Director from Aboriginal Health, Mike Molino, Margaret Farrell and Merilee Cox, all from the Department of Health. I think it's really important that their participation is acknowledged, and the wonderful insight that they had and the contributions that they were able to provide through their first-hand experience of working in this sector. I would also like to thank the Territory Health Minister, John Elfrink, for his cooperation and particularly enabling his department staff to participate in this forum. It was really good to get a Northern Territory Government's perspective on the issues at hand as well. Everyone at the table brought a unique perspective to the discussion, and I would like to, as I said, thank them for sharing their experiences. So in my electorate, we have faced some challenges with mental health. There are relatively high rates of substance abuse and homelessness. We have relatively small population, but an increasingly diverse one. We are also geographically isolated from other service providers. Some of the issues discussed included clinical planning and mapping in the field, education among the public and also health professionals, including GPs, to help a suite of assistance to those requiring mental health care, the funding gap in care programs, the crossover between corrections and mental health care, the gap in the levels of care available in Darwin and Palmerston, and the effect of alcohol abuse and ice, particularly involving young people in that community. As I said, the forum was extremely insightful, and I will take on all the opinions on board, and I will consider them in the event of any possible reform in this area. I've already spoken with the Minister, Susan Lee, and about the feedback that we received, and she was very receptive to this. So I guess I want to just reassure people that I will do my very best to make sure that the experiences from this forum will inform the national debate.
Thank you.